Veronica, hello.
Hello.
Would you start by introducing yourself and what you do here at Working with Cancer?
So thanks, Barbara. So as you said, I head up policy and consulting. But as we're a small organization, we get involved in the different elements of what we do in supporting organization. Under policy consulting, my prime area is to working with employers and helping them to develop the policies and the frameworks in which they can support their employees who are impacted by cancer, either as patients or as caregivers. And then also I work across with colleagues, with sporting in the training area, and I also coach as well. Following those three areas, so it's quite busy
Indeed,
in the
quite
in
busy.
those areas. And then prior to that, I mean, I bring with me. I've been working in the oncology space. Actually, I was doing some for probably more than 20 years. Prior to coming to to oncology, I worked for a large pharmaceutical company, Novartis, where I worked in their oncology division. And so formerly, I was actually the head of HR for Europe. And then in the last 10 years of my tenure before moving to working with cancer, I headed up patient engagement, patient advocacy within the oncology space, both at Europe and a global level. And that basically meant helping to design clinical trials to making sure they were patient-centric, and looking at issues of access, the postcode lottery, etc., and many things for that. So, but there's one thing having a theoretical understanding, even though you have so much empathy, and then another thing actually being impacted and having cancer close to home. So, yeah.
Yeah.